how excited I am to be back again. I have been coming for many years. First time I was here, I didn't have that PhD behind my name. I was just starting the PhD program. It was only PT CLT-LANA, so last time I was here was the first time I put that behind my name, so this will be the second time. Last time I was here, I was just getting over meningitis, pneumonia, and mono. So it was this triad of just ickiness. Bad time last time I was here, but I made it through, so that was great. So I'm excited to be back again. You guys are an inspiration to me. I feel like I'm coming back to family every time I come back. So really, really appreciate you allowing me to come back year after year. And I try to mix it up. You've been hearing me talk about lymphedema for years and years. Try to make it a little bit different each time so you don't hear the same thing over and over. But so hopefully I will do that for you again today. And I'll try not to go over because I could talk about it all day. I can just take the whole day if you want me to. So just to get an overview of what the lymphatic system is, because that's where we need to start, just in case there's people who are new, but this should be a review. We this is if everything's working fine. This is kind of what's happening. This is just a very general overview. We've got blood that brings the blood we've got arteries that bring the blood away from the heart. We've got the veins that bring the blood back up to the heart, and then there is this thing called the lymphatic system that brings extra fluid that the heart or the veins can't bring back up to the heart. And everything's great if everything's working fine, but unfortunately things don't always work fine, especially in Koehler syndrome. So with Koehler syndrome, you guys know what that is. That get used to this. There can be a malformation of the venous and or the lymphatic system. So those things that bring that fluid back up to the heart, there can be an issue with them. So in the veins, the venous malformation can cause that fluid not to go back up to the heart like it's supposed to, and cause venous swelling. And if the lymphatic system's not working properly, we can get lymphatic swelling. So with KTS, it can be a combination of the two. So it can be the lymphatic or the venous system. Either way, it's causing some type of swelling. So what is lymphedema in particular? So I'm going to be focusing on lymphedema. So lymphedema is swelling caused by an abnormal accumulation of protein-rich fluid, whereas if it's a venous insufficiency or a venous backflow, it's blood that's polluted in there. This is different. This is a protein-rich fluid. It's a thicker fluid that sits out in the tissue and caused by lymphatic injury or malformation. The lymphatic system's everywhere throughout the body, so you can get lymphedema anywhere, just like you can get KTS everywhere. So it can be located in the head, arms, legs, trunk, genital, any of those areas. It's chronic and progressive if it's left untreated. Can lead to increased swelling, so increased growth of the lymphedema. The swelling keeps getting worse and worse. Loss of function and chronic infections. I want to really focus on that. I think I focused on that last time. Chronic infections, because the lymphatic system is part of our immune system. So if it's not working properly, you can get infections. Skin changes and interferes with wound healing. So like I said, lymphatic system is part of the circulatory system, so it helps balance the body's fluids. So if it's not working properly, you can get swelling. And also is part of the immune system, so it's what fights off infections. So if we have an open wound or a cut, bacteria gets into the skin or something gets into the skin, we're at high risk of getting infection if the lymphatic system is not moving that bacteria, getting rid of it out of the body. Because the lymphatic system is like a sanitation system. It is what gets rid of all the garbage out of our body. So if it's not working properly, you're at higher risk of getting infections. Hopefully this is all our review for you, right? So there's two types of lymphedema, and so it depends on what's going on. So primary lymphedema is if you were born with it, if there's some sort of lymphatic malformation or a developmental issue within the lymphatic system, and that would be primary lymphedema. Secondary lymphedema can be is that you're born with a lymphatic system, that's fine, but something has overwhelmed it. So you might have had injury because of maybe surgery or some sort of trauma to the tissue. Chronic infections can cause damage to lymph vessels. venous insufficiency. So if your venous system isn't working properly, over time it overloads the lymphatic system and can do some damage to it. So there's different reasons of why someone might get lymphedema, and this is just kind of a general overview. So distinguishing which one it is may be difficult. Sometimes, and most time, it kind of doesn't matter. If you have lymphedema, you have lymphedema. You want to treat it. So the signs and symptoms are swelling of a body part, heaviness, tightness, or fullness, tingling sensation, tight clothing or jewelry, decreased flexibility, feeling of achiness of limb and tire more easily, for pain, burning, throbbing, skin tissue changes, infections. How many of you have signs of this out there? So I'm pointing it out because lymphedema signs are similar to KTS, aren't they? Like, how do you distinguish if it's lymphedema or KTS? Can you tell just by looking at the area which one's lymphedema or which one's KTS? You kind of can't, can you? You can't just look at it and see what's going on there. Anyone would guess which one's lymphedema, which one's KTS? Because they do have one that's pure lymphedema, which one's KTS, but it's probably not. So it's kind of cheating because usually you see some of the port wine stains. So KTS, and this is somebody with lymphedema because of gynecological cancer. Lymphedema or KTS. This one's a little easier because you probably see a little bit of port wine stains on there. But this here is someone with primary lymphedema that does not have KTS. And I'm trying to show different pictures because your presentation having KTS, lymphedema patients have similar presentation. Regardless if they have KTS or not, it happens anywhere on the body and the look of it can be different. So this looks like it's not that big of a problem. This person was born with a lymphatic disorder. They do not have KTS, but it's a lymphatic malformation. So how do you know if you have lymphedema? So I have the benefit of talking on Saturday mornings always, which is kind of nice because I end up tweaking my presentation Friday night because I listen to everybody's presentation on Friday. So I feel like I'm cheating a little bit so I can focus on what maybe you really want to hear because I try to not go over what somebody else said. I really enjoyed Dr. DePalma's presentation yesterday on lymphedema. So I tweaked mine a little bit so I could focus on something that you might be a little bit new or something. So the one thing I thought of yesterday that wasn't necessarily talked about, and I just want to mention it here, I'm not going to go into a lot of the diagnostics because everybody that talked yesterday, they're the key players in the diagnostics of what's going on because they have the imaging and techniques. So when it comes to lymphedema, how do you determine if it's lymphedema or not? Well, oftentimes we just go by medical history. There might be history of it in the family, just the appearance, the clinical assessment, if there's blebs, if there's drainage, drainage, lymphoceles, that type of thing. We know that there's probably lymphatic system, issues in the lymphatic system. The one thing, like I said, that wasn't mentioned yesterday is lymphoscintigraphy, which is an imaging technique that can be used. It's not needed for everybody because oftentimes the medical history and just the clinical assessment, we can determine what's going on. But this is another imaging technique that can be used where, has anyone had a lymphoscintigraphy here? No? Okay. So what it is they inject a dye in between the left spaces of either the hands or the toes, and that dye gets picked up, and it's got large protein molecules that only the lymph system can pick up. And what you look for is to see if that protein molecule or this dye moves out of the tissue like it's supposed to. So this here is an image. This person actually had bypass surgery, so that you can see their scar here. And this is, I think this was 6 months later, a lymphoscintigraphy. So this here is their right leg. So the image on the left here, this side is normal. This is what would happen. They would inject a dye, you watch it, that dye that gets injected moves out of the body, everything is fine. With lymphoscintigraphy, that dye gets injected and it just sits there because those protein molecules that the lymph system is supposed to get rid of and move out of the body just stay stagnant. And this is what the image looks like. It just sits there. So the dye sits there, and then we know something's going on with the lymphatic. There's an issue with the lymphatic problem, or the lymphatic system. Like I said, it's not necessary all the time because oftentimes just the medical history and the clinical assessments can determine if there's lymphedema. But it can be used if there's a question of something going on. Unfortunately, it's not great imaging. I mean, if you look at this, it just is telling us, oh yeah, there's something going on in the lymphatic system. We don't have a way to image those lymph vessels like we do the arteries and the veins. You saw all those great pictures yesterday that Dr. Burrows had shown on the slides, or everybody was showing lots of nice imaging pictures, and we unfortunately don't have a good way of imaging the lymphatic system. So this is what we have so far, really, is lymphoscintigraphy, and then there's other testing that can be done too. So what should you do if you do, oh, you know what, I should go back here. One thing I should say, sometimes even with this, we can't really determine. And my point is, it doesn't matter. If you have a venous insufficiency, oftentimes the treatment is the same for venous insufficiency as it is for lymphedema. There's just some additive treatments that can be used for lymphedema too. So regardless if you have lymphedema or not, the treatment options are oftentimes similar. So what should you do if you do have lymphedema? This should all be reviewed too. So I'm going to go through it fairly quickly, but I'm going to focus a little bit more on the compression this time around and exercises this time around. So manual lymph drainage, which is a light massage to help move the fluid to other areas of the body that the lymphatic system is working properly. So manual lymph drainage can help with some of those skin changes going on, that hardness, that firmness. It can help move that fluid, try to open up some new pathways. Education and risk reduction practices in skincare. I focused on this last time I was here, so I'm not going to go through this in detail because there's a lot of kind of do's and don'ts. Basically, the do's and don'ts are to prevent extra fluid going out into the tissue. So in general, that's what those precautions that I went through last time, and you can find them. There's summary and there's a detailed description on the National Lymphedema Network website for the lymphedema risk reduction. So I encourage you, if you don't know them already and you weren't here last time, to go to the NLN website and find the lymph reduction guidelines that the National Lymphedema Network has on their website. Wound care is not necessarily the 4 components of lymphedema treatment, but I'm just putting it in here because I know it's an issue in KTS, and PTs do wound care also, and I think people don't know that. So as a lymphedema specialist, there is a lot of wound care that goes with it. So we do debridement, dressing changes, we have a lot of modalities that we use for wound care. This is a pulsed lavage. That's just a whole other presentation in itself. So I just want to point out that wound care can be done by therapists who are specialized in doing wound care. I think that's all I was going to say this one. So compression therapy. I am such an advocate for this, and it's kind of a passion of mine, so I'm going to spend a little bit of time but like I said, I'm going to probably focus a little bit more on the exercise. I have to keep an eye on my time so I don't go over. So compression bandaging, Dr. DePomelo hadn't talked about it yet. Oops, the wrong one. Yesterday. So the use of short stretch bandages. I had talked about this, like I said, in the past many times, and I want to stress the importance of the compression, especially with short stretch bandages, because that is what can help reduce swelling. You can get into compression garment later, but the compression bandages, using the short stretch bandages, meaning not an ACE bandage, something that doesn't have as much stretch because they have those specific qualities can help move that fluid. So the compression bandages are put on the extremities so that there's more layers distally or towards the foot or towards the hand, less layers proximally. There's a lot of different padding and different devices that we can use to help with the swelling, the hardness, the shaping of it. So how we would treat a leg that looks like this would be just a straight bandage. You put some padding on, it's fairly easy. But when you go to bandage a leg like this, if you don't know what you're doing, you can do damage. So that's why it's important to know what you're doing to get you for you to see a certified lymphedema therapist who really knows what they're doing. Because how we bandage a leg that looks like this, there's a lot of padding. You can see the skin changes going on down here, that there's probably wound care that's needed. And somebody who knows what they're doing really should be addressing these issues. So that you can get the proper wound care, you can get the proper skin care, and the proper bandaging, so that this leg is bandaged so that when you put a bandage on, it's not digging into these lobules, okay? Compression garments. So the compression bandages are to help reduce the swelling. So if you get into a compression garment and you have swelling, it's gonna get loose, and there's no point of having it on because it's not gonna fit very quickly, or you would hope. So you want to go through the treatment first to reduce the swelling and then get into the compression garment. And it is so important that this is fitting properly. So I encourage you to find a fitter that you can work with who will listen to your needs. So if it's cutting into an area, that they will send it back, because that is what the fitters should be doing. They should be working with you and not saying, oh, this is good enough. They shouldn't be sending you a compression garment through the mail and expecting you to know how to put it on properly. They should be checking it. So I encourage you to nag and be a pain, because I know this is a huge issue probably for many of you. How many of you are wearing compression garments? How many of you are happy with your compression garment? Well, that's good. You've been working. How many of you had an easy time getting into a compression garment the first time around? Exactly. You guys should come up here and tell the stories. Really, you should, because I know it's not easy. So keep nagging. Don't expect the first time around it to be perfect. And the fitters should be working with you to get the proper fit. So keep it up. And there's so many different varieties of compression that can be used. So what works for one person isn't always going to work for the next person. If you have an area that's not, your swelling isn't being contained very well, there's different adaptations to the garments that can be put in place. So like this here is a pad to put a little bit of extra compression on the top of the hand if that's a problematic area. So there's a lot of different things that can be done to help with giving the compression to contain that swelling. I just want to stress the importance of compression with activity. So when you have compression on, it has a graded compression. So regardless if you're wearing bandages or the garment, the compression is more, putting a little bit more pressure distally or towards the hand and towards the leg, and less as it goes proximally towards your trunk, as you can see on this picture. So it's giving this external compression on the outside when and moving that fluid to where we want it to go. Now exercise helps improve the lymphatic system and the venous flow, but when you add compression to it, what happens is there's even a more beneficial effect. So that's why I'm stressing exercise compression here today, because you have the compression giving that, pushing the fluid externally, has that external forces from the outside. And when you are doing exercise, when your muscle bulks up and it's pushing on the inside, where that fluid, where that swelling occurs, is right underneath the skin. So it's between that muscle and it's between the skin. So it is giving pressure from the inside and the outside to move that fluid upward. Does that make sense? So that's why I'm stressing the importance of compression and exercise combination today. So who should treat for lymphedema? Again, something else I want to stress this time, and I don't think I've stressed in the past, I may have a little bit, but a physical therapist or occupational therapist who's certified in lymphedema treatment. And I want to stress the certification. Not all PTs and OTs have training for lymphedema when they come out of school, or none of them do actually. They have to go to training beyond that. And there's a lot of different continuing ed classes that are being offered that's like a weekend course. And people come out thinking that they're certified lymphedema therapists when they've had maybe 20 hours of training. In order to be certified, you have to have 135 hours minimum of training. So that's what I'm wanting to stress today too, is that make sure you're getting into to a therapist who has a certification. If they have CLT-LANA behind their name, it means that they're certified lymphedema therapists of the Lymphology Association of North America. They've gone through the training and they've gone to have to do a special test. And you know that anybody that has that behind their name, they have the training. So there's no question. Safe place to go. If they have just CLT behind their name, it doesn't mean that they don't have the certification, but I would ask questions, because if somebody who has gone to just a weekend course and maybe has had 20 hours, they think they can put CLT behind their name, and that is not the case. So there's some issues out there with the training. So just because someone has CLT behind their name, I would ask a little bit more questions, okay? I just want to stress that so that you're getting the proper treatment, because I want you to get the best treatment possible. And just going to a weekend course is not necessarily the best option for you if you're seeing a therapist. So how do you find a lymphedema therapist? I've given you this, I think, every time I come in, but I'm giving it to you again. These are all places that you can go online. They're certification places that have 135 hours of training or more. Oftentimes people are going to advanced training at a lot of these courses. All you have to do is click on their website, and each one is a little bit different. Sometimes you just have to put in your zip code, sometimes you put in the city that you're at, sometimes you just click on the state. But I just encourage you to go to, and each one has their own keeps track of their own therapist. So you really have to go to each one. There's not just one site you can go to and put a name in, or put your address and whatever in, and it'll go to it. Unfortunately, you have to go to each one of them to find one that might be in your area. So you have a lot of different options. But if you go to these sites, then you know that the person has had the proper training also. Does anybody have any questions? I try to keep this as laid back and relaxed. That's the benefit of being Saturday, because I don't have to be so professional here. To be a little bit more relaxed. Does anybody have questions so far? Yeah.
Is the certification for a lymphedema specialist the same in every state?
Yes. Yes. So it's by the school. So it's people will go to these schools. These schools will come to the different states. So as long as they've gone to the certification, it's this. So there's like the state of Minnesota doesn't have a different certification than Wisconsin or California. It's kind of the national standards. Yeah.
What about RNs? My therapist, she's an RN, and she's very knowledgeable.
Yep.
She has lymphedema herself.
Yep, there are massage therapists and RNs that can go to get the training, and that would be perfectly fine if you want to. I'm a PT and an advocate for therapy because we are movement specialists, so we look at more than just lymphedema. So I'm hoping that I can get that across today too, that we can address the wounds, we can address the pain, we can address the musculoskeletal issues, we can address more than just the lymphedema. And that's why it's, probably 100% of the time, there's more issues than just lymphedema. So that's why I would first seek out a lymphedema therapist who is probably PT or OT, so that you can get an overall assessment of what's going on, not just the lymphedema. If you have a leg length discrepancy, they can address the musculoskeletal biomechanical issues that go with it, get you the heel lifts, all of the things that Dr. DePomelo had focused on yesterday, we can treat because, so it's a broader, you get a broader assessment. Does that help? So there's nothing wrong with going to an RN or even a massage therapist that can treat it if they have had the certification, but they're going to be treating the lymphedema and maybe their area of expertise. Some nurses do have some wound care background. They can't do debridement though, so if you have all of that tissue that needs to be removed, we are trained and can do more than just what the nurses have to offer. But by all means, I am not downplaying their role. I am just trying to tell you what we have to offer as therapists. Does that help answer your question? Yeah.
Yeah, is possible all or even part of this presentation might be available after the event is over, for like a download or something?
Yeah, I can get a copy of it for you.
It will be on the website behind the member login in conference videos, the entire thing.
Great.
So, let's see how I'm doing. I'm still doing okay. So I'm going to focus, so I wanted to talk about just in general, living a healthy lifestyle. I wanted to focus on lymphedema, but just in general, these components of exercise and staying active, the importance, eating a nutritious diet, losing and maintaining healthy weight, because the higher your BMI, the worse your lymphedema can be. Reducing stress, stop smoking, that's not good for circulation, and seek out psychological counseling if needed. But I am still going to focus on the exercise and being active, so that's what I'm going to be talking about here next. So this can be applied to everybody in the room, regardless if you have KTS or not, and that's what, like I said, as a physical therapist, I'm a movement specialist. So my focus is on getting people moving, functioning, back to their normal activities, as close to normal activities as possible. So we not just focus on lymphedema, but we focus on movement. So if there's an impairment, if you have a range of motion issue, we can address that. If you have pain, we can address that. What we're trying to do is reduce the amount of impairments that you're experiencing, regardless of what they are, to help you get back to function. We can help adapt so you can get back to as close to a normal function as possible. So we're focused on movement and function. And I think Dr. Connell had talked about that. He's Kim and our doctor. So we work closely with trying to get the function. We can't do surgery, we can't do imaging, we can't do all that stuff, but we do have, this is our area of focus, this is our expertise area. So benefits of exercise, it can improve function, quality of life. It can improve self-esteem. I really enjoyed Pat's comment running the half marathon yesterday. Yeah.
Would you recommend that someone does the lymphatic drainage massage before they go into an exercise routine?
It kind of doesn't matter, but I would recommend that you do it all. So if you want to exercise first, and do whatever fits into your routine. My main focus is that if you're going to do the exercise and you have compression, wear that compression with it. So if you want to do the MLD before or after, it really doesn't matter. I really would like people to just do it. So whatever fits into your schedule. So sometimes people will do MLD in the morning before maybe they go to work, and they'll exercise when they get home, or vice versa. So because it is, dealing with lymphedema is time consuming, as you all know. It's a time consuming, takes a lot of time out of the day. And so whatever works for you is what I want you to do. Yeah.
Is there a special type of compression garment to use in the exercise, like swimming? When you do swimming, do we have to use, material-wise, do we have to use a special type of
Usually you don't have to wear compression in the pool. And the reason is because the water gives you the compression, basically. And it's kind of giving you this pseudo massage at the same time, which is why you're getting ahead of, I have it in one of the slides, why pool therapy is good for lymphedema. Because the deeper your body is in the water, the more pressure there is. So it has this built-in gradient compression. Regardless of the shape of your leg, it can kind of help promote that fluid from moving out of the body. Doesn't mean you can't wear compression in the pool, because I know some people do. What I tell people, if you want to wear compression in the pool, just wear one of your old garments. I would not recommend wearing a new garment, because you're going to wreck it, because the bleach or the salt, whatever pool you're going into, it's really harsh. So if you're going to wear compression, or if you want to wear compression in the pool, wear an old garment. So there's no special garment except that I already said, wear an old one, because it's going to get wrecked. So don't get one, they're expensive, don't put one of your new ones on, or it's not even necessary, because the pool is automatically doing it. That's a very good question, though.
So you would recommend doing the massage daily? Is that recommended daily lymphatic drainage?
If you can, yep, absolutely. Yeah, so if you're going to treatment, they're teaching you how to do the self-massage, the self-manual lymph drainage, and I recommend doing it on a daily basis if you can. But if you had to choose which one you're going to do, I would choose exercise and compression combination. So if you have only so many minutes in the day, I would do compression and exercise. And if you have time for the manual lymph drainage, you can do, it's only going to benefit you also in addition to it. So, like I said, I know in reality, yes, I want you to do all of this, but I know how busy my schedule gets, and stuff has to give some once in a while. So if you're going to do something, compression and exercise is more beneficial, because exercise has so many different benefits, as I'm going through here, that there's more than just improving the lymphatic system and the venous flow through it. It improves cardiovascular, it can help with balance, it gives you more energy. There's just so many benefits of exercise. So if you have to choose one, do exercise and just make sure you're wearing your garment when you're doing it. Somebody else had a question?
Yeah, thank you. I'm just wondering if you have any statistics on the success of manual lymph drainage and so on. I mean, I went through a pretty long session on it, didn't get much for results, and I don't know if that's because I use a compression pump at night and my compression gradient on my garment's already at 80 millimeters. So for me, it was not effective, but I'd be kind of interested to hear what success stories you do have, so on.
It can help with, especially the fibrotic tissue. There isn't a lot of research to back up. It's more theoretical, but that's unfortunately a lot of the medical, especially in physical therapy. Manual lymph drainage, we have a lot of clinical reasoning and clinical outcomes that can back it up, but we don't have a lot of the research to back up the benefits of the manual lymph drainage. There are a few studies out there. I can't name them off the top of my head. I can definitely get them to you, but clinically, my own experience, when someone has a lot of fibrotic tissue, there's been a lot of benefit of softening that tissue with the manual drainage. There's a lot of other, I'm not going into a lot of other adjunct treatments that can be done with it, like you're using the pump. So what works for one person might not work for the next person. So in your case, it might be that the compression and the exercise is more beneficial, or the pump, whatever it is. And with saying that, that's why I went back to get my PhD, because we don't have enough research to back this up.
Okay.
And that's why I'm trying.
The other part of it too is I actually have two compression pumps right now. I have the Lymphopress, which really cranks it hard, but when I went to the manual lymph drainage, they convinced me to get the new kind of pump out. It's like
the tactile system.
I believe I believe that's it.
Yeah.
Again, I would do that for like an hour or whatever before, and then I would put on the Lymphopress, and I just eventually abandoned the other one and just used the Lymphopress.
Okay.
I finally got the best results. Anything that you've seen on the sort of manual lymph drainage pump? It's much more delicate, I know.
Right. So it depends on the person again. I know the Lymphopress does have to give more compression, and what I would say, it depends on how the person is responding to treatment. So during treatment, I'm always assessing how much compression am I putting on with the bandaging. That helps me decide how much compression you should have for a garment. How much compression, how much pressure do I need to put on you while I'm doing manual lymph drainage? If you have a lot of fibrotic tissue, I'm probably having to push a little bit harder, and the benefits of the Lymphopress may be a little bit better. So you can adjust the pressures on some of these, but I know the pressures kind of go around. Plus, what I want to say with that is the fit. How the sleeve fits you might be different in both scenarios. That one might be getting adequate compression in a certain area better than the other one. So a compression sleeve using a pump is similar to a compression garment. If you don't have a good fit, it's not going to be as beneficial. So there's a lot of variance with that.
And I know with any pump, I know there's accumulation of fluid up in the groin. At least my lymph system functions there, so if I get it up to there, then it sort of gets it back into the system and so on. So I know that's another problem that's been occurring with the compression pumps.
Yes, so compression pumps, there are some that just come up to, so if it's a leg, it just can come up to the groin and it doesn't incorporate the trunk.
Right.
Same with the arm, but there are the newer pumps like the Lymphedema and the tactile systems, they incorporate the trunk too, so you're getting the flow more proximally.
Lymphopress now has one that incorporates more of the stomach and so on?
Yes, I believe they do now, yes.
Okay.
Yeah, there's a few other companies out there too that, that you can try. Those are kind of the two main ones, but there are a few other ones out there.
Do you have a list of vendors anywhere?
What's that?
Do you have a list of vendors?
I don't, but I can put one together. Yep, I can get you.
I'd be interested.
a
Okay,
list.
thank you.
Yeah. Write me a note. Go to pen or pencil. Feel free to email me, by all means. I can get you, because there's some that it's like a whole one, it almost looks like a sleeping bag.
Yeah, the manual lymph drainage one, the tactile one or whatever, that one does have coverage, I know, over the
Yes.
stomach, but the Lymphopress I have, it's
Yeah.
rather old, but it's just got a sleeve up to the.
There are some other ones that are incorporating the trunk too, so I'd be happy to get you a list.
Thank you.
Yeah. So the pumps can be beneficial for some people, and some people, they are sitting in their closet. Unfortunately, I know a lot of people that are just sitting in their closet. And you have one that's sitting in your closet because you found one that works better.
It'll be up on the KT website before long.
Oh, thank you. I do want to say with pumps that there's definitely a place for them, but if you have to choose between a pump and exercise, I'm an advocate for exercise. Because you're sitting there passively in the pumps. So as a therapist, it's not my first line of defense for someone who has lymphedema. I would rather do air compression and exercise because there's so many beneficial effects of the exercises than passively sitting in a pump for an hour and a half, because if you have an hour and a half of time, I'd rather you get up and move. But that's me because I'm a therapist and I'm a movement person. I feel that there's so many more benefits of that. But I definitely will support a group compression pump without a doubt, because there's definitely a place for it. But I just wanted to say that because that's my soapbox. So, again, I'm talking about exercise and movement. So there's different types of exercise. There's aerobic exercise, which improves the cardiovascular system, so that's running, walking, that type of thing. There's stretching to increase flexibility, so you get the motion. If you are not able to fully extend your knee or fully extend your arm, you're not going to be able to get the full movement, and there's probably pain that goes along with it. Strengthening is just increasing the muscle bulk, getting stronger. This year is the 2008 physical activity guidelines, so like I said, regardless if you have KTS, regardless if you have lymphedema, everyone can benefit from exercise. And this is the recommendations for ages 5 to 17. So kids, 60 minutes a week of moderate to vigorous intensity aerobic activity, so most of it should be aerobic, and that can include playing. So when I'm talking about exercise, I'm talking about physical activity. It doesn't mean you have to have a structured exercise program. It means go play for 60 minutes outside in the yard. Throw the ball, play jump rope, do whatever you want. What's the new thing? Pokemon Go? Don't get hit by a car. For adults between the ages of 18 and 64, the recommendations are 150 minutes a week, 2 hours and 30 minutes. How many in here did that? Good. I see, I didn't raise my hand. No, I tried. I don't always get there. Or 75 minutes of vigorous intensity aerobic activity. The aerobic activity should be about 10 minutes, so you can break it up however you want. 10 minutes 3 times a day for 5 days a week. You want to do 150 all at once? Great, but I don't think it has that time. And muscle strengthening of the major muscle group should be performed 2 days a week. So you should incorporate the aerobic and the strengthening, and it's not in the guidelines, but I would encourage flexibility or range of motion exercises too, just so you don't lose your range of motion. For those ages over 65, it's basically the same thing, the aerobic exercise, the strengthening. The other thing is the recommended balance and flexibility exercise, because we don't have as good a balance as we get older. So I'm just putting these in here to remind you that we should all be doing some sort of exercise because of the benefits. Is exercise safe? Because you have some sort of impairment, is it okay to exercise? And the answer is yes. The health benefits of physical activity outweigh any risk. So everyone can benefit from exercise and physical activity regardless of age, gender, shape, size, ethnicity, disability. It needs to be individualized for each person. So if you have a cardiovascular issue, it might need to be modified. If you have KTS, depending on where it is, it might need to be modified. So work with your physician to help figure out the best exercise program for you if you have any limitations. Exercise can improve, like I said, there's a lot of benefits of exercise. So how do you get started? Like I said, talk with your physicians, make sure it's okay if you have limitations, take those into consideration. The type and intensity of exercise will depend on each individual's needs. Like I said, if you have a cardiovascular disorder, if you have a lung disorder, if you have an infection going on, that would change things. A lot of different things can come into play with that, but it doesn't mean you still can't move. Choose activities and exercise that you enjoy. How many of you here love running? Well, I know you are going to raise your hand. So if you don't love running, it might not be the exercise you want to choose. Do something else. If you like swimming, if you like walking, just find something that you enjoy. And if you get bored with it, try something else. I want to focus on, because this is on lymphedema, so lymphedema and exercise. Some things you should think about is that if you have lymphedema, you should start out slow and progress your way up. Doesn't mean you can't run a half marathon if you have some sort of disorder. It means that you might want to progress a little bit more slowly, because if I decide, or if one of you guys decide you want to run a half marathon or a full marathon tomorrow, you could injure yourself. Doesn't mean you can't do it eventually, but tomorrow's probably not the best time to think about starting that. So you have to gradually work your way into it. If there's pain or increased swelling, stop what you're doing. Reevaluate what's happening. If you have swelling after exercise, elevate the area, reduce the exercise intensity and duration next time you do your exercise. Wear compression during the exercise, and pool exercise is good. I already talked about that. Lots of different options. You can do group exercise, you can do individual exercise. Group exercise has benefits because of the socialization. There's a lot of, some people really enjoy doing group exercise. Some people just want to exercise on their own, in their own living room, because they don't want everyone to see them sweating. So whatever works for you, that's what you should do. And like I said, talking about exercise, it's not just a structured program. It can be anything. Anything that's increasing physical activity. So I'm saying exercise, but any type of physical activity is really an exercise. So I'm giving you some things to do. Put on music and dance. Take your dog for a walk. Walk or cycle to the grocery store. Use the stairs. How many of you use the stairs today? Oh, look at Kat, you just keep raising your hand every time I ask something. Exercise. So I challenge you all to, when you leave today, take the stairs instead of the elevator back to your room. That's a good exercise. It is something that you incorporate into your daily activities without saying, oh, I got to exercise now, I just don't have the time. It's like, you know what? You have to go to your room anyway, so take the stairs instead of the elevator. It's those simple things that you can incorporate into your everyday life that just those small changes can make a difference. Park your car in the farthest spot in the lot and wake up and walk instead of waiting for the first row. Just park in the last one. Your car won't get dinged then either. So there's benefits to that. Find a partner and have them encourage you, because if you don't want to exercise and you have someone who's calling you and saying, get out here, that's a motivator. Play ping pong or any activity-based video game with your kids. Like I said, Pokemon Go. How many people play that here? or will admit to it, I should say. But I'm afraid I'll get hit by a car or something, or go over the edge of a cliff, or craziness. If you don't feel like exercising, do it anyways. Set a goal of doing just 10 minutes of light activity. So if you're sitting at the TV, and you're like, oh, I'm just too tired, and I just don't want to do anything, try just setting down the remote control and getting up and turning the channel next time you have to do it. That's simple enough, isn't it? You should have enough energy to at least get up to the top, change the TV. But that is exercise, that is physical activity. Make those small changes. That's what I'm encouraging. Like I said, it doesn't necessarily have to be structured. There's things in your daily routine that maybe you can modify that would help you increase your activity just a little bit more. Watch your neighbors or coworkers' office instead of calling. So if you're in the office and you have to, ask somebody a quick question instead of emailing, go up the stairs to the next floor up and ask them the question. Wash your car, pick up your takeout food instead of having it delivered. So we're getting lazy, everything is just coming to us. Walk to the kitchen and cut up fruits and vegetables. Like I said, simple things you can do in your own home, just try to move. Good, summary. I'm like, oh gosh, I'm running over here. So, summary, compression and exercise are beneficial if you have a lymphatic or venous impairment, so that's why I was focusing on them. Regardless if this is venous or if it's lymphatic, compression and exercise can help. Obviously, it's different if you have an arterial issue too, so that's where the diagnostics is important to understand what's going on with your body. And seek out treatment with a certified lymphedema therapist if you have lymphedema. Make sure they have the proper training so you're getting good care. Regardless if it's PT or OT, like I said, I encourage PT or OT because they can do more generally now look at your whole body, what's going on. But if it's a nurse, if it's a massage therapist, it's whatever, just find somebody who has the proper training so that they're not going to do harm and put a bandage on you that's going to cut in and cause sores or anything like that. And everyone can benefit from exercise and physical activity, regardless of age, gender, shape, size, ethnicity, and disabilities. So just move your body, whatever you're doing. And here I have you sitting for 45 minutes. You don't get that out of the stretch. So I should have actually made this a little more interactive, shouldn't I? So it's the most effective pill we sell. Chase it around a handheld cord for an hour a day. If we could capture what we do as therapists and give it as a pill, we would be billionaires actually. But unfortunately, we don't deal with the pharmacy side of things. We're movement specialized, so we specialize in exercise and movement, but we have a lot of modalities that can help you get moving because there's a lot of limitations that can occur so that you aren't moving like you probably could be. So there's a lot of functional limitations which we address as therapists. So that's where I am ending. I unfortunately have to leave right after this. I'm going to be volunteering. My brother is the president of the Minnesota chapter of the United Special Sportsmen's Alliance up in Forest Lake, and I'm just putting a plug in because it's something if you are a young child who's interested in outdoor activities. This is like Make-A-Wish, but it's for outdoor activities. So if you enjoy hunting or fishing or anything like that, and you have any disability as a child, and it's also for veterans, they make that event happen. So today, I will be going up, and so this here is a Crossbow, and I'm sure there's people who aren't hunters, so I apologize if I'm offending you. But it's not as if you have to go hunting, it's just that you get to try using a bow for the first time. And if you have any limitations, there's adaptions that they work with the child so that they can go out and do some of these events. So I'm going to be heading right up there after this to go to, I have an issue with it. Carbonite needs to be backed up. Don't do it now, please. So I'm just putting it out there as an option. So it's like Make-A-Wish, but you don't have to, if any type of disability, you don't have to, it doesn't have to be like any type thing. So if you're interested, there's lots and lots and lots of different events.
Is that nationwide?
It is nationwide, so there's chapters in each state, and there's just one going on today, and I was double booked, so unfortunately I have to leave right after this, otherwise I'd be here for the panel, but I'm heading back up to Forest Lake to help out with that event today. So I'm just putting the plug in because regardless of where you're at in the United States, there's different chapters. If you're interested in it, by all means, I encourage you to look it up on the website. So, any questions? I think I went over. Sorry, Dave.
It's all right.
Do you have any recommendations for finding a good fitter? I mean, is there like, we live in the city, so are you University of Minnesota now?
Yeah, I know.
Do you see patients for fitting?
I do not. So we used to do all of our own fittings, which is why I'm such an advocate for it, because I used to do my own fittings. But because of the insurance changes, we're not allowed to do fittings anymore, and you have to send them to a fitter. So I struggle with that myself, trying to get a good fitter, because that's why I encourage you to keep nagging the fitters, because that's what we have to do with the fitters if it's not fitting properly. So I would like everyone to go to the fitter, get their garment, but come back to the therapist again so they can assess it to make sure it's the right fit and work with the fitter. So a therapist that can work with the fitter, I wish I had a big list of good fitters out there. Unfortunately, I don't. I have a few that I work with that are really great. I would just encourage trying to find a fitter who has a variety of different garments as options. So try not to just focus on one, because what works for one person doesn't always work for the other. So there's Juzo, there's Jokes, there's Solaris, there's Medi, there's all these different types of compression garments out there. And what works for one person really, really well, the other might not, because they all fit a little bit different, especially if it's off the shelf and the material's a little bit different. So if you have to do custom. So there's a lot of variety out there, and I wish I had this special wand that said, yes, here's a good fitter, and that's a huge struggle. I empathize for everybody. Where can you look for one? Right, the DME supply places usually have fitters. So the durable medical equipment suppliers usually have fitters. So just look them up in your local area. Not all DME providers have fitters though, so you might have to call around. Usually if you're getting treatment, they already have some sort of connection with a fitter. The VODR website, let me go back. Let me go back here. Oh, it's not working anymore. So the website, the VODR website has similar to Find a Certified Therapist. They do have a pull-down menu that you find a fitter, but it's very scarce, because I went on it a couple times and there's really not a big list of people. I mean, there's none in Minnesota. When I put Minnesota in, there are fitters in Minnesota, so it's not inclusive. So that might be another place to look. The VODR school website does carry a list of some fitters, but So the best thing is to call the different durable medical equipment suppliers in your area, and if you're not happy with one, you can try another. Just be a nag and keep working with your fitter until you get a good fit. Yeah, I wish I had a good solution to that, but I don't have a solution myself, so I struggle. Yeah.
Is it true that MLD can be dangerous when we have clots? I mean, I know DVT is anyway dangerous, but does MLD help to remove any kind of clots, like superficial clots or DVT?
Right, so if you have a thrombosis, you don't want to be moving it. So yeah, you wouldn't want to be doing MLD if you have clots. So that's one of the precautions. So that's why you have to go through the training so you know and recognize if someone might have the possibility. So signs of a clot, we sometimes catch those. I've sent many patients back or sent them to the ER because I'm suspecting they have a clot and I don't touch them. If they are on anticoagulants and it's afterwards, you get the physician's okay, then you can put some compression and things on, but you need to work with the physician to find out when it's okay to start. But usually after the anticoagulants, it's fine. But if you have an acute clot, yeah, you don't want to be doing anything to move it, absolutely. And that's why that training is so important, because the therapists who know that. But yeah, you don't want to be doing, so if anybody, actually though, I should state that here, if anybody is doing their own self-massage and you know you have a clot, stop doing it. Ask your doctor to make sure it's okay if you do come into those circumstances. Any other questions? Well, I hope I brought something new again this time around instead of the same old, and like I said, I try to change it up a little bit each time I come, and again, I really appreciate you inviting me back again, and I really enjoy you guys' company, and it's fun to see you all and see you guys grow. I've seen a lot of kids grow over time, so thank you very much. Feel free to come find me afterwards if you have questions, but then I do have to go right away, and I really apologize for that.